Welcome to your most favorite channel, Heartbeat. This channel is mainly meant for MBBS students and medical professionals. My name is Dr. Amrit Kejriwal, and I am teaching mainly general medicine and applied medicine. As it is said, I learnt a lot from my teachers. I learnt a bit more from my colleagues, but the most I learned from my students. And I'm still learning, and I still consider myself to be a student of medicine. Today we learn something about cough. Cough is a protective reflex and prevents our lower respiratory tract being infected. It protects the lungs and the other structures from pneumonia. So it's predominantly a protective reflex. What will happen in case a person does not have any cough? No cough, what will happen to the person? So there will be retention of the secretions increased, and there are always chances of aspiration. These two together may lead to various other effects such as infection, atelectasis, and respiratory embarrassment. If a cough is excessive, it may induce vomiting, syncope, muscular pain, and rib fractures. Quite commonly, you do get muscular pain and rib fractures in patients. It can also aggravate hernias, lower backache, urinary incontinence, and it will decrease social interaction. So a person who has cough may not like to go to parties and other activities. There are various causes of impaired cough, such as weakness of respiratory muscles, pain in the chest wall or abdominal wall can cause impairment of cough, chest wall deformity, impaired glottic closure or tracheostomy, tracheobronchomalacia, abnormal airway secretions, central respiratory depression, such as an anesthetized agent or sedated patient. So these are the causes for impaired cough that are commonly seen. Weakness of respiratory muscle, pain, chest wall or abdominal, deformity of the chest wall, tracheostomy, tracheobronchomalacia, abnormal airway secretion, and central respiratory depression. Depending on the duration of the cough is classified into three types: acute cough, less than 3 weeks; subacute cough, between 3 to 8 weeks; and chronic cough, greater than 8 weeks. So, we have the acute cough and then we have the subacute cough. Various causes of acute cough can be classified into respiratory tract infection, aspiration, or inhalation of toxic fumes or chemicals. Subacute cough, 3 to 8 weeks in duration. Tracheobronchitis is the commonest cause, and tracheobronchitis usually follows after a respiratory tract infection. Chronic cough, by definition, is greater than 8 weeks. The various etiologies: inflammatory, infectious, neoplastic, and cardiovascular. Many times in our clinical practice, we get a patient who's got no clinical finding and a normal X-ray and is a non-smoker. So in such patients, we have to evaluate what is the cause. So they may be having a cough variant asthma, they may be having gastroesophageal reflux, nasopharyngeal drainage or post-nasal drip, medications such as ACE inhibitors, or chronic eosinophilic bronchitis. So when a patient comes to us, we take the history, especially of drug intake and ACE inhibitors, any other systemic manifestations, do the physical examination. In the physical examination, you have to look for cardiopulmonary disease, look for auditory canals, look at the upper airway, and look for nails for clubbing for evidence of any systemic disease. Again, a systemic examination and a systemic history is also evaluated in the required in the evaluation of cough for systemic disease such as SLE or rheumatoid arthritis, which can cause cough as a presenting symptom. You have to do one X-ray of the chest, look for any localized lesion, which can give us a clue. Do a CBC to rule out eosinophilia, and you're supposed to examine the expectoration also. There's a cough hypersensitive syndrome. It's a predominantly a dry cough. There's sensitivity in the throat, worse with talking and laughing, and females are greater affected than males. So this is due to increase in the neurons sensitivity. Coming to the treatment, take a detailed history of the patient, look for all the associated symptoms and signs for cough, do detailed clinical examination, and do the investigations. Generally, X-ray chest, CBC, and sputum examination will reveal most of the common causes. However, there was one patient who had a dry hacking cough which comes about 5-6 years back, and he had a complete loss of appetite. X-ray chest was done, there was nothing detected. Blood test was done, nothing detected. CT chest was done, nothing significant. And when he had complete loss of appetite also, then we did a sonography of the abdomen, and he was found to be having gallbladder adenoma. The gallbladder adenoma was subsequently removed, and this caused a resolution of his cough symptoms. A very unusual cause of dry cough. And of course, with the history and clinical examination and investigations, if nothing is found, then you do a CT chest of the patient. Hopefully, you'll get something in this